Hello, everyone. My name is Terica, and welcome to my channel. I'm a nurse practitioner with over 12 years of experience, and I've had the opportunity to work in several areas of healthcare, including caring for patients living with benign prostatic hyperplasia, also known as BPH. Now, let me ask you this. Have you ever noticed you're using the bathroom more often than usual, especially at night? Or maybe you feel like you have to go, but when you try to urinate, it's slow or doesn't feel like you fully emptied your bladder. And for some men, this has become a regular thing. If that sounds familiar, this could be something called BPH. That stands for benign prostatic hyperplasia, which simply means an enlarged prostate. Now, let me make this make sense. The prostate is a gland that sits below your bladder, and the tube that carries the urine, it's called the urethra, it runs right through it. So when the prostate starts to enlarge, it begins to press on that tube. And that's the cause of those urinary symptoms. So you might notice things like going to the bathroom more often, waking up in the middle of the night to urinate more than once. Your urine stream may feel weaker than normal. You might have trouble getting started when you try to go. Or when you're done, it can feel like your bladder didn't fully empty. And over time, this becomes frustrating. Now, now that we have that basic concept of BPH, let's talk about treatment because this is where people have questions. There are a few common medications used for BPH, and each one works a little different. First, you have medications like alfuzosin or Flomax. These help relax the muscles around the prostate and the bladder. So instead of everything being tight, it opens things up and urine can flow more easily. Then you have another group like Proscar or Avodart, which are also called finasteride. These actually work over time to shrink the prostate. They affect the hormones that cause the prostate to grow. So, this is more of a long term approach, not immediate relief. And sometimes people are on a combination of both, one to relax and one to shrink. But here's what I really want you to understand: medication is helpful, but it's not the only thing that matters. For example, try to limit the fluids right before bedtime. Because if you're drinking a lot at night, you're going to be waking up more. Also, cut back on the caffeine and alcohol. Yes, caffeine and alcohol, because those can irritate the bladder and make your symptoms worse. And don't ignore the urge to go. Holding it too long can actually make things worse over a period of time. Even something as simple as double voiding can help. Let me explain. That just means you go once, you wait a moment, and then try again. That can help empty the bladder more completely. And staying active matters too. Movement helps overall circulation and can support better urinary function. And I also want to talk about this because this is also important. What happens if the medications are not enough? And this does happen for some men. Sometimes symptoms they continue or the prostate continues to enlarge even while you're on medications. And that's when your provider may start talking about procedures. Now, don't let the word procedure scare you because not all of them are major surgeries. They are less invasive procedures that can help improve your urine flow, such as something called a TURP. This is one of the most common procedures where excess prostate tissue is removed to open up the flow of urine. And then you have laser therapy. This laser this uses laser energy to remove or shrink your prostate tissue. And then you have something called Urolift. This is where small implants are used to hold the prostate tissue away from the urethra so urine can flow more freely. And then there's also water vapor therapy. Yes, this uses steam to shrink the extra prostate tissue, which helps relieve pressure. These are usually done without major surgery, and recovery tends to be quicker. Now, in more advanced cases or when symptoms are more severe, surgery may be indicated. So, when you look at all of this, treatment for BPH isn't just one step. It can move from lifestyle changes, medications, and then procedures if necessary. And I want you to hear this, just because you need a procedure doesn't mean something has gone wrong. Let me repeat that. Just because you need a procedure doesn't mean something has gone wrong. It just means your body needs a different level of support. So when you look at it all together, BPH is common, especially as men get older, but it's also manageable. And the key is paying attention early. Don't ignore the symptoms, because the sooner you address it, the better your outcome is. And I always like to bring it back to this: taking care of your body matters. The word says in the book of 3 John 1 and 2, Beloved, I pray that you may prosper in all things and be in health. That includes paying attention to what your body is telling you and taking action when something feels off. And before we end today, I want to briefly touch on who's more at risk for BPH. The biggest factor is age. As men get older, the prostate naturally begins to enlarge. So this is something we tend to see more often in men at over the age of 50, and even more as men get into their 60s and beyond. But age isn't the only factor. Other things that can increase the risk include your family history. So if your dad, your grandfather had prostate issues, your risk may be higher. Hormonal changes that naturally just happen as you age. And if you're already diagnosed with diabetes or heart disease, you're at more risk for acquiring BPH. And even low physical activity, your lifestyle. If you sit more than you're more active, then it increases your risk. So when you look at all of it, this is something that develops gradually over a period of time. It's not something that happens overnight. But the good news is, when you understand what's going on, you can take the right steps early. I hope this video has helped you and brought some clarity. Before you leave today, please like, share, and subscribe to this video if it has helped you in any way.